Candice Langford, pelvic and sexual health physiotherapist, and this is the Nurture Pod. We are talking pee, poo, pleasure, pain, periods, pregnancy, postpartum, peri, and postmenopause. All the P's, all supposedly taboo, yet essential to our holistic health and well-being. We are shining a light on each and every one of these, both confidently and comfortably. Let's get curious. Trauma is a topic that you have most likely heard popping up all around you, and rightly so. It is something that we desperately need to dive deeper into. Trauma-informed care, even more so. As a practitioner or a patient, we really need to know and understand what this is so that we can identify what triggers us, the signs, what it looks like, so that we can acknowledge, give it credit, realize, oh, it's because of X, Y, or Z, and then adapt. Make that behavioral response, whatever it may be, in order to better advocate for yourself as a patient or provide better as a practitioner. Today, we are going to be discussing exactly this, trauma-informed care, with none other than Krystyna Holland. I'm so excited for you to learn from this wonderful woman. But first, one of the most common questions that comes my way is how to have better and more satisfying sex. Although this is multifactorial, I so value the potential of erotic audio content to pique mind and body arousal. The audio app Guided by Glow aims to do just that. Their guided sexual meditation journeys gives you the space to slow down, relax, and connect you to your senses, your creativity, and of course, nurture your relationship to pleasure as you drop deeply inside the feeling body. Listen until the end of today's episode for a special gift from Guided by Glow. Okay, hello everybody. So this is Dr. Krystyna Holland, physiotherapist with pronouns she, her. She is a physical therapist in Denver, Colorado, specializing in the provision of trauma-informed pelvic floor care to individuals across gender identity spectrum. In addition to helping folks feel confident in their ability to live without leaking and to have pleasurable sex, Krystyna aims to change the fundamental patient-provider relationship from one that centers from the provider as a problem solver to one that focuses on collaboration between the patient and the provider. Thank you so much for being here, Krystyna. I absolutely appreciate your precious time.
Hi, thanks so much for having me.
Wonderful to have you here. Let's get to it because I know that you are full of knowledge to share with those that are listening. The question that I have for you, because you have seen the perspective of being the physio or the practitioner providing the trauma-informed care, as well as having the unique experience of being the patient who requires the trauma-informed approach to care. Please share with us how and why is trauma-informed care essential for the physio/practitioner perspective in treating individuals, and how does that impact the patient experience themselves? Please, I'm so excited to hear from you because I really believe that this is essential information for every practitioner out there.
Yeah, I couldn't agree more. So I started getting involved and really interested in trauma-informed care, what it was, what it meant when I was a pelvic patient. So when I was in physical therapy school, getting my doctorate, even at that time, I knew I wanted to be a pelvic floor specialist. And so I, in all of that, ended up needing a pelvic surgeries and then required pelvic floor physical therapy afterward. And I found myself that I had experienced medical trauma, and I found myself being triggered in appointments without having the words or the language around what was happening. And something that came to mind at that time was the provider that I was seeing was very competent, very knowledgeable, I think well-meaning, but it didn't come across in a way that made me feel seen, didn't make me feel heard, didn't make me feel like my values were important to her. And I think it was especially clear in relation to the fact that, pelvic surgeries, pelvic care can be very intimate. And so I was caught very much off guard, and I wondered to myself, even in this like budding practitioner position that I was in, what is the difference between who this physician is, or like, and how who they maybe want to be, or who they thought they were going to be when they left medical school? How does someone who is competent, who I think is well-meaning, end up being someone who might, I think, accidentally? I don't think anyone gets into medicine to purposefully hurt folks, right? Like we all did it because we wanted to help people. How is that someone who then is perpetuating trauma? And how am I, as someone who is, white, cisgender, had private insurance in the US at the time, how was I someone that then experienced that trauma? So
Yeah.
it was a lot to think about when I was in PG school, but it really started me down this path of like, what is trauma informed care? What does that really mean? And why is it important, especially in pelvic health care?
Yeah.
And the conclusion ultimately that I came to is that trauma informed care, to me, because I've done a lot of reading and there are lots of heady definitions, but trauma informed care to me is recognizing that we all have the potential to accidentally perpetuate harm, and what are we intentionally doing to not do that. And so you can imagine that has huge impacts on patient care. It's very common, and I'm sure you've heard a lot of the same things in terms of having people come in and feel that their concerns have been dismissed by other providers. They feel like it's all in their head. They feel like they are all of the things that they've experienced somehow get separated from what their diagnosis now is, and how that impacts them, their relationships, their lives. And ultimately, at the end of the day, what is important about trauma-informed care, and trauma, I think, kind of more generally for us all to know, is that when we experience trauma, our brains go offline, right? So the front part of our brain that works to do decision-making and the logical part is no longer accessible when we're in this trauma response.
Yeah.
So our sympathetic nervous system, our fight or flight system, gets dialed way, way up. Frontal lobe goes offline, and we still have parts of our brain that are keeping us moving. People might not even know that we're having that experience. We might not know we're having that experience. But our heart rate increases, our breathing rate increases, our breathing depth decreases. And so we're having this big response throughout our whole bodies without necessarily any conscious awareness or awareness that other people can have that that's occurring. And so when that happens, it makes it really hard to engage in any situation, let alone a care situation that might actively be either re-traumatizing us or triggering our trauma, even if the provider doesn't know.
Yeah.
So the reason I bring all of that up is because from a patient perspective, patients need to know that that's a thing that can happen. They need to know if they do have trauma responses like that, so that they can help their providers to navigate those situations. And they need to know that so that there's some amount of explanation or kind of sense to be made of when people have these big responses that don't maybe they say things or do things or react to things in ways that aren't typical of them, don't align with their values, or maybe they're crying when they're not expecting it, or they've gotten angry, or they've shut down, or they don't feel like they are able to engage verbally, or they feel like they have to run out of the room.
Yeah.
And I think a lot of people have a lot of shame about these responses when they don't know they're happening,
Yeah.
or they don't know why.
100%.
So to know that that your brain is offline and that you're no longer really in the driver's seat of your own actions, I think gives people a lot of space to just have their experience without so much of the shame.
Yeah, definitely.
Yeah,
I was just
from
gonna
a provider
say,
standpoint.
look at us.
Go ahead.
So I was just going to say the way in which you just explained it. It really is just. I think just that in itself is going to be so valuable for people that are listening, because it's almost giving people permission. They're realizing that it's okay if I get triggered and don't understand what it is that triggered me and what it is that's happening in me. I'm running away from that practitioner. I'm out the door, I'm in my car, and I'm out of there. Even if you don't fully understand it, it's okay that it happened. It happens to people. And we are in the day and age where we can make sense of it, and we can treat and we can manage. And like what you are doing is you're providing those practitioners that are on the other side of the table, on the other side of the bed, you're providing them with the tools to manage and deal with those situations and provide, like you say, a space for those patients to experience that. I've had patients that have been told, stop it, you're being a little girl, get out of this office, you're upsetting everyone else here. And it's heartbreaking to hear that. I can only imagine what it must be like for the patient. And I can only imagine the lack of control and lack of insight that the practitioner must be feeling in order to get to that point where the only resolution is to tell the person that they are being silly and they must leave because they're upsetting people. So it's uncomfortable for practitioners to acknowledge, I actually don't know how to deal with this. But now we have the tools. We have people like you that have this unique perspective from both sides, that has the capacity to really inform, so that we can provide this trauma informed care and, yeah, allow people to heal holistically. I love what you do. Hence, I asked
Well,
you
thank
to
you
come and
so
share
much.
your
And I think you
pearls.
nailed it. I absolutely think you nailed the providers feel really out of control. I think especially when people respond in ways you don't expect, not to mention the fact, I think we have this narrative that as medical providers or providers of any kind, that we're in a room, when we're in a room, we're supposed to have left all of our humanity kind of at the door. Like we're supposed to be blank slates to whatever's coming at us. And the reality is that's not how it works, right? We don't unplug our nervous systems, leave them at the door, and go in and just like are able to function. So someone else's trauma response can also trigger our own trauma responses or our own feelings of maybe inadequacy or lack of control or anything. And so now you're also having this response of like, of behaving in a way that maybe you don't expect. And then you have to reconcile like, oh God, oftentimes you'll just leave the room and you're like, what the heck just happened? And so it's tempting to blame it on the patient because it gives us more space to feel like, oh, that wasn't my fault.
Mm-hmm.
And not from a place of like you want to blame anyone, and not from a place of anything, I think, except that you want to be really good at the work that you're doing. You care very much about it. And so if you at any point feel like maybe you didn't do the best job you could have done, your system is also trying to protect you. Yeah. So the thing about trauma-informed care that is so important to know is that it impacts everyone, right? Trauma is so ubiquitous. It is especially right now, I think, with COVID. Not even I think, like I know with COVID, everyone is experiencing trauma, has experienced trauma to some extent in some way. And so, yeah, of course, our cups are a little bit more empty. And that's going to impact the way that we're able to show up in all aspects of our lives, work included. Yeah. And so if one of the things that I learned from my perspective is, so I had this experience as a patient and I was like, oh, I eventually came to the conclusion of, oh, I'm being triggered. Like, this is why I'm crying in all of these appointments, even though that's not a typical move for me. And then I learned about it and I could like conceptualize around it and I can give all the explanations. And I talked to lots and lots of patients about it and talk about, exactly what we just talked about in terms of the sympathetic nervous system and how it works. But it wasn't until I was so upregulated myself, where I had so many experiences, and it was actually during COVID, that I felt really out of control, especially being in healthcare during a pandemic. It's a really, really hard thing to manage. And there wasn't a lot of support and no one knew what they were doing. And we were all just doing the best that we could. Mm-hmm. And all of a sudden I was like, oh, I am having this response. This is a me thing. I started to feel kind of panicky. I was feeling like short of patience. And all of a sudden I was like, I heard my own voice explaining to patients in my head and was thinking to myself, oh yeah, that's me. That's what's happening right now. And so that was important for me to know so that I could get the support that I needed in order to be effective at my job. Because there was no way I could be the world's greatest, kindest, most compassionate clinician. But if my frontal lobe is offline, there is not a way for me to be able to access all of those things. So trauma-informed care applies to patients and the principles in terms of like ongoing informed consent and minimizing harm, and allowing people, not allowing your own assumptions to show up in the room, but allowing people space to tell you about themselves. All of those things are so important to know. And it's also important to be able to apply those things to ourselves.
Yeah. Yeah. I love that you've switched it. And those that are watching or listening are going to realize that this is not just about treating the patients. It's about, as a practitioner, acknowledging when I am being triggered. That patient might be triggered by X, but that might be triggering me. And my response is because I have been triggered. And it's something so important for the practitioner to be able to identify. I always kind of bring up 3 little steps, and that's identify. You acknowledge, oh, okay, that's why. And then you can adapt to that. You can make the necessary change that follows from identifying. But it's when we think, oh, this trauma-informed thing, it's not for me. I'm not triggered. I'm not traumatized. It's when we keep ourselves at a distance from being curious and learning and understanding and thinking laterally, then we cannot identify, we cannot acknowledge, we cannot adapt, and we can't be better providers. So I love that you're looking at this from both sides of the spectrum, because I really just expected you to be telling us about the patient side, and how to be a better provider. I didn't think about the fact that the practitioner themselves can be traumatized or traumatized or triggered, etc., and be bringing that to the table without realizing. I love that you brought that up. Thank you. I think that's really valuable.
Yeah. I just think it's so important because I think, especially with high rates of burnout, I think at rates that we have never seen before even, it's so important to take care of ourselves. And I think as it relates kind of back to your point about the patient side and even more of the medical side, if our goal is to help people get out of pain, and we know that many of the things that contribute to someone's pain experience are perceptions of safety, whether or not that's like, I feel safe, or kind of what their nervous system is perceiving as safe or unsafe. If you are unintentionally triggering that nervous system to feel unsafe, whether that is through touch that the patient doesn't expect, whether that's through the language that you're using, whether that's through maybe an unintentional assumption about that patient's gender identity, their sexual orientation, their partnership status, or anything having to do with any of the ways that they look or that systemic oppression might impact them. Any of those things are going to give someone's nervous system that feeling, the inkling of unsafety, and that's going to make it really, really hard for you to help them out of pain.
Yeah.
So to me, trauma-informed care is also the medicine, because the way that we make people's nervous systems feel safe is by allowing their systems, or minimizing our potential for perpetuating harm.
Yeah, 100%. I've used this example before, but what I've noticed in a lot of the people that I work with is the way in which you approach. So, for example, this might be examples that help people that are listening to understand. For example, if I approach certain patients from a certain side of the bed, that might trigger them. If I approach them from the other side, they may be perfectly fine. But it's about identifying that and realizing when that patient is feeling triggered and what exactly triggered them. Another thing that I've seen in practices, I've had patients that have to see where my hands are at all times. Or another thing is that if I move too quickly, then some patients find that quite triggering, and that triggers this response. And you, as a practitioner, need to be trauma informed, so you realize, what is it that has triggered this person, and how can I hold the space now in order for that person to process what they're feeling, so that we're not kind of perpetuating this response. So I'm hoping that those just little examples give people an idea as to the physical side of things, not verbal, not just one aspect of what might be triggering for someone. But those are things that I've seen thus far. I'm sure you've seen and heard a number of different examples, but I just thought, in case people are not quite seeing how the patients might be triggered, that might be a little bit helpful there.
Oh yeah, absolutely. And I think sometimes it's tempting that I want to just mention to then be like, oh, what? Another way that I think about trauma-informed care is not asking like, what is wrong with this person, but what happened to this person, such that their response actually makes a lot of sense, right? So
Yeah.
rather than thinking like, oh, what is wrong with this person? Why did they act that way? My thought is,
Mm.
oh, I wonder what happened in this person's life such that their system learned that this was the thing that they needed to do to keep them safe. It's not a
Yeah.
question I ask people. Ultimately, I think it's important to just note that I don't ever ask people about their trauma. I don't. One, I'm certainly not qualified to handle what comes out after
Yeah.
that.
Yeah.
Although certainly, if people want to disclose, as I always try and leave space for that,
Yeah.
and then connect them to appropriate referrals, normally mental health therapists and behavioral health providers.
Mm.
And again, not from this place of you need this because there's something wrong with you, but this is something that would help you because your brain is working in overdrive. Your
Yeah.
system is working so hard to keep you safe. And that's exhausting, and it takes so much energy, and it can be contributing to pain. And so let's get you to see someone who can maybe help you to process some of that stuff so that your system can feel a little bit more safe. And I think it often has very wide reaching impacts kind of
Yeah.
throughout an individual's life. But I like to
Yeah.
mention, I don't ask people about their trauma. And frankly, I don't actually, to perform trauma informed care, I don't need to know if people have had trauma, like individually.
Yeah.
I just treat everyone in the same way. I ask the same questions. I always provide a menu of options in terms of the treatment that we're doing. I'm always asking for permission and consent before I ask invasive questions. I am always telling people what I'm doing with my hands, like what they'll feel, how they'll know how they can stop an exam, how they can revoke consent, whether
Yes.
that is verbally or physically. Um, and then talking to them extensively about basically just all the ways that they can practice agency and autonomy in order to be able to be a really active participant in their medical decisions.
I love that you've given those examples because that is so valuable for people to realize the ways in which patients can advocate for themselves and realize I'm allowed to step out, I can withdraw consent, I can, ask the practitioner. Let's say the practitioner hasn't provided you with opportunities to withdraw or opportunities to reduce the likelihood of being triggered. You might say to that practitioner, please maybe move a bit slower, or rather stand aside, or I would like to see your hands at all times. Sometimes these are the things that you yourself might need to implement within the practice. So please carry on, because this is beautiful insight that you're giving us.
I think just piggybacking off of what you've said, in that remembering, I think people and I experienced this when I was a patient who was also learning to be a provider. I experienced this feeling of, oh, I can't advocate for my needs because the provider knows best, or they're not going to like me, or they're not going to give me good care. And a whole bunch of other things. And ultimately, I just want to say to people, like, you can advocate for yourself. You are in charge of your own body. You are in charge of your own medical care. And so something that I really believe strongly in is that if you are able to find a provider who you feel like cares about you, and who has maybe a little bit more time or a little bit more expertise, or basically someone that you just feel safe being able to say, like, hey, that's not going to work for me. And that's sometimes harder than other times, and harder for some people than others. And I want to leave space for that as well. But it's so important because, again, if your system doesn't feel safe, it's going to be really hard for you to be able to access all of the benefit of the treatment. So in my own experience as a patient, that doctor was so competent, and I could hear from like the medical part of my brain. I knew what she was doing was gold standard care. She was providing excellent medical services, and I did not trust her as far as I could throw her. And it wasn't about her as a person. It wasn't because she was mean or not trustworthy. It was that my system was not jiving. And so ultimately I sought out several other providers until I found someone where my system could basically sigh a breath of relief and feel like, oh, okay, this person has me.
Yes, and that can make all the difference. You can have two practitioners that provide the exact type, and let's look at physiotherapists, for example, vaginismus. They might be providing the exact type of homework, physical care, etc. But if one is holding a space for you, allows you to be vulnerable, allows you to talk when you feel ready, it can make the world of difference for patients. And going back to where I said that I thought I was wanting to say something, I appreciate that you've brought up that you don't push patients to disclose trauma, because one, it may not be the trauma, they may not realize something was traumatic to them because it's not socially acceptable, and I'm using inverted commas with my fingers, as something that is traumatic. Your brain may have perceived that as a traumatic experience, and you may be triggered, and it might have been way in your childhood that you don't even remember. And now in your adulthood, or wherever you are in life, now your body might be bringing that up, and you might be feeling triggered by something. So it's not that someone with vaginismus always has a sexual trauma. Absolutely not. It can be a number of things that can contribute to that. So we can't go pestering our patients, and we can't go putting our patients in a position where they are not comfortable to disclose something just out of our own curiosity. I might be curious as to what potentially brought this patient to where they are today, but my curiosity is not what's going to help this person with regards to what is their trauma. You have to hold that space and wait until that person's ready to disclose, if that is what they ever want to do. I've absolutely treated people that just don't want to talk about it. They might have processed it, they're not there right now, and the most important thing to them is not bringing up old trauma, it's getting to their goals, where their goals are at now. So yeah, we can't use our own curiosity to put patients in a position where they're just not comfortable to be yet. But we have to keep that space for them when they're ready. So
Yeah,
thank you.
absolutely. And in fact, bringing up someone's trauma or asking them to disclose when they're not ready or if they feel pressured um, is something that can be really harmful and damaging to people. So that is actually the opposite of trauma-informed care. The whole thing about it is that you can and should perform trauma-informed care and trauma-informed care principles without necessarily ever talking about the specific thing,
Mhm.
at least from a physio perspective, right? Behavioral health providers, I can't even begin to speak to that because that's
Yeah.
it's not my jam. But it is so important to just know why you're asking questions, in what ways those questions are going to impact the way that you're providing treatment, and letting people know that. So I work with a lot of people um, across the gender identity spectrum. I work with a lot of transgender and non-binary people, and even questions about their bodies, like what their anatomy is or how their anatomy has impacted their sex lives, right? A lot of those questions can actually bring up trauma for lots of people, um, based on what their own lived experience has been up until that point. And so one of my goals is always to be very judicious about the questions I'm asking. And if I do feel like I have to ask potentially triggering or invasive questions, one, explaining why I'm doing that and letting people know it's actually not for my own curiosity. It's because these are the things that this could be impacting, and so I want to make sure that we're covering what you need from every angle. And would it be okay if I asked you those questions now? So getting consent even before I'm asking potentially invasive questions.
Yeah, so important. It's funny because I always speak of curiosity as a good thing. And it is, self discovery, self exploration, really, digging deeper into your own, into yourself. I think that's where curiosity is so valuable and underutilized. But this is most certainly a point where the practitioner's curiosity is not it goes against what I have said in the past, but it is just two different contexts, and I just want people to acknowledge that. Yeah, amazing. Sure, Christina, you have just changed perspectives, I'm sure, and you've helped people to realize as practitioners how they can approach. You've given tools already, you've given key points where people can identify trauma in themselves as practitioners and trauma in patients, and how to start to go about managing that. But you've also, really given us that insight, your personal experience, as well as patients that you've worked with, the ways in which trauma might be triggered and the ways in which your body might respond to that. And I'm so incredibly grateful. I love what you're doing. Like I said before, I think that this should be stock standard educational um, content within every practitioner's um, basic education. And that's why we feel out of control. That's why we respond in ways that we just didn't expect ourselves to, is because it's not part of our foundation of education, and it most certainly should be. And I'm pretty sure it will be sooner rather than later, especially in the pelvic health perspective. I think we see it a lot more because our type of work is very intimate and people do feel vulnerable, especially in their first sessions because they don't know what to expect. So we see it a lot more and we see the value of it. And I can just see this really infiltrating into every single medical field. And I'm excited for that because the level of care that we are going to be able to offer is going to be next level when we are all trauma informed as patients as well as providers. So, wow, thank you so much for your work. Is there anything else you want to add? Is there anything you want to kind of, do you want to sum this up for us in some way?
I was just thinking about what you were saying about, I do think medicine is moving in a more trauma-informed direction, which is, I'm so grateful for. And you're right, it's not currently something that is just integrated into all of our training. And like I was saying, I think it's not just a way of practicing medicine. Sometimes I think it is the medicine. So ultimately, if people take anything away from this, my hope is that they take away that if you're experiencing big responses or responding in ways that you don't expect or can't explain, it's quite possible that your frontal lobe is offline and your nervous system is just trying really hard to keep you safe.
Yeah.
And that's whether you're a patient or a provider. And to your point about curiosity, being curious about your own responses is so important. But maybe not expressing that curiosity about others' responses to them. Maybe that's the difference in what we're talking about. And then just leaving space for people to be valid in their feelings, be valid in their experiences, and leave that space for ourselves as well.
Yeah, divine, amazing. Tell us, Krystyna, how can people hear more from you, see more from you, experience, learn from you? What have you got going on and coming up, and how can people continue to learn from you?
Yeah, Instagram is a great way. So I put out a lot of content on Instagram, both around pelvic health specific things as well as trauma-informed care. I teach trauma-informed care trainings virtually. I have one that I think will have already come out by the time this airs, but there are replays and things, and you can find all of that information on my website. It's inclusivecarellc.com. And I think you said that will be in the show notes, so that'll be great. And then other than that, getting on my email list, which you can also do either through the link in my Instagram bio or on my website. So all of those are great ways to get in touch with me and keep tabs on all the stuff going on.
Absolutely perfect. I mean, that's how I came to know you, was through Instagram, and I just sat in awe reading and learning about trauma-informed care. And from that point, I've made sure that I approach patients as cautiously as I can, not knowing that person, the depth of that person's story, and really just trying to my best to hold a space for individuals to experience that patient-provider interaction in their own bespoke way, whatever it is that they need on that day. Yeah, so I thank you for that, for making sure that I am a trauma-informed practitioner to the best of my knowledge, as is. But I do look forward to engaging with more and more of your content and learning more and more from you, because like I said, you've got a very unique perspective, and especially not just being the patient as well as a provider, but being trauma-informed through your studies. You integrated that subconsciously into your studies right from the get-go. So I think that's why you are so passionate, and why it comes across in everything that you do. And you're just influencing people to become more and more trauma informed. So thank you so much, Krystyna. I really appreciate your precious time, and I look forward to sharing this particular episode with those out there that are listening and watching, etc. So have a wonderful day ahead, and thank you once again.
Thank you so much.
Well, NurturePod listeners, until next time, please review and subscribe, and as always, stay curious. As a special treat for listening to today's episode, you can head over to the nurturepelvichealth.com website and use the code NurturePod for 20% discount on all pelvic and sexual health courses. And now, let's indulge in a gift from Guided by Glow, whose mission it is to create a transformational practice of awakening your sensual feeling body, igniting your imagination, and cultivating a positive and thriving sexual relationship with yourself. Try today and take $20 off your annual membership using promo code NURTURE. Go to guidedbyglow.com or find it in the App Store.